What's up, beautiful people? Another day, another study. This topic is one that hits really close to home. For those who don't know, my wife and I actually had to do IVF, and that's the reason we have our beautiful baby boy, Trey, aka Richard Edward Harris III. And so we went through this whole process together. I saw how difficult it could be. I tried to support Brittany as best as I could as a husband and as a physician. And actually, I talk about this extensively in a chapter of the book I'm writing. Infertility worldwide affects about 12 to 15% of the population. In the US, from 2011 to 2019, this report was actually published last year. Infertility rates have actually plateaued, but we're seeing it in the similar range, 12 to 15%, depending on which segment of the population you're looking at. Evidence supports that lifestyle factors like diet may play a role in the outcome of assisted reproductive technologies, or ART. ART are things like IUI and IVF. So this study examined adherence to 8 different dietary patterns through a food frequency questionnaire, preconception, so before the embryo was implanted, and then looked at various outcomes. And so they found that the different dietary patterns were not really associated with the probability of pregnancy or live birth after IVF or IUI treatment. They did find that after pregnancy, those who had higher adherence to especially the AHA dietary pattern had a lower risk of pregnancy loss. And that was comparing like the highest to the lowest. There was about a 13% to 15%, depending on if you were talking about total or clinical pregnancy loss. And they saw similar reductions with DASH and Mediterranean diet, HEI and AHEI nutrition patterns. However, the associations were weaker. The AHA dietary pattern supports the consumption liberally of fruits and vegetables, whole grains, fish, shellfish, nuts, legumes, and says to minimize the intake of sugar-sweetened beverages, sodium, processed meats, and saturated fats. So overall, is this like a cure-all? Is your diet going to obviously fix any and all infertility issues? No. But it's just another in a line of studies showing that our daily habits, things like nutrition, exercise, stress management, sleep, can have significant outcomes on various health markers that we care about. And I know when we were going through this as a couple, Brittany and I outlined some nutritional strategies to ensure that we had the best chance that we could control everything that we could control to have a successful pregnancy and a successful birth. And I'm so grateful and thank God that we had that result that we did.